Hey everybody, Will Martin, family nurse practitioner working in emergency medicine, and welcome to today's talk. It is Tuesday evening, November 30th, and I just wanted to touch base with my 5 or 10 people that actually look at this channel. And first of all, I appreciate you looking and keeping track of what I'm saying here. The bottom line is, for right now, anyone who's looked at this channel knows that I've just been experimenting with a lot of different things, learning the technology, learning how to make videos. So I've tried a lot of different things. I do have a focus in mind. I do have something that I really want to do with this channel. But for right now, it's just been a lot of fun just with trial and error. But here's the thing. I'm working tomorrow, as a matter of fact, in the emergency department. And I was up there today to do some ultrasound training, and our wait times were over 800 minutes. Okay, so that's, 11, 12 hours of wait time. I've never seen anything like that in our department. And, we're a level 1 trauma center. We take everything, and we have a waiting room that is just exploding right now. And what's the cause? Well, I think, the cause is that we have a lack of beds upstairs because of a shortage of nurses. And of course, we've lost, by some accounts, around 80 people to the vaccine mandate. How many of those are nurses, I'm not sure, but I think around 40 nurses were lost to the vaccine mandate. But we're down over 400 nursing positions anyway. So it just means that we've lost a lot of floor beds, we've lost ICU beds. Are we seeing a lot of COVID? We're seeing some, but we're not seeing a tremendous amount of really, really sick people. So we're fortunate in that regard. But our emergency department bed capacity is significantly reduced because we have so many boarders. And for those that aren't in the business, a boarder is someone who's been admitted to the hospital, but there's no room upstairs. And so that person stays in the emergency department until a bed eventually opens up. And that also means that you have an emergency department nurse that now has to take care of that patient as if they were an ICU patient or a floor patient. So that takes more nursing staff away from taking care of emergencies that come in through the door because they're busy taking care of these ICU or floor patients. So it's just a bad situation all the way around. And what's ironic is that you have myself as a nurse practitioner, I work with PAs, I work with physicians, and we're capable of doing a lot more than we're doing. I'm capable of seeing, several patients an hour, 3 patients an hour, and I'm lucky if I'm seeing 1 patient an hour because there just isn't the physical space to be able to see patients, to be able to examine them. And that's very frustrating. And of course, I'm an RN. I still have an RN, so I can still technically do some of the nursing work. But honestly, I don't know if you'd want me doing that. I haven't worked as a bedside nurse in 25 years, so I don't know how much help I would be to them. But we're in a pretty bad situation right now, and I don't know what tomorrow's going to bring. But we just got word that our ability to close the emergency department, when I say close, that just simply means that we divert ambulances away from us whenever possible. But again, we're the trauma center, so all traumas are still going to come into us. All burns are going to come into us. All pediatric cases are still going to come in. We're a stroke center, so strokes are still going to come in as well. So even if we're quote unquote closed, we're really not closed. But as you can imagine, we don't have physical space to see many of these patients that are coming in through the door. So obviously we're seeing them in the hallway, we're seeing them, in every nook and cranny of the department, which is just not ideal. So anyway, I came across one article today. I just want to share this with you. This is, where is this? University of Maryland will graduate 172 nursing students early due to the labor shortage. I found that really quite interesting. And I don't know what your thoughts are on this. This goes back to something that I had talked about a while ago. That back when I went to nursing school, we started out with 63 people. We graduated 17. And I think that's because they really weeded people out during those 3 years of that diploma program that I went to. Now I think people enter nursing programs, they're moved along through the system. Of course, they have to pass the NCLEX test at the end, so everyone has to pass it. But I don't think they're as prepared necessarily for what the job entails until they're out and they're working. And I think they work for a year or two, and a lot of folks say, this isn't for me, and they leave. And that's why I think even though we're graduating a lot of nurses every year, I don't think they're necessarily staying in the profession for a long period of time. But here we are taking nursing students, brand new nursing students who really don't have any experience, and we're putting them into the labor pool early. And just intuitively, that tells me that that's going to lead to problems. And it's certainly nothing against those nursing students. Most of them are probably very dedicated, and they're going to do the best job that they possibly can. But it's not fair to them because we're really setting them up for failure as well. They're going to all of a sudden be thrust into situations that they don't have experience in and that they're not prepared for. So I just see a lot of problems with this. It seems like a good idea on the surface. You're getting more bodies and throwing more bodies towards the problem. But, in the end, are we going to say that this wasn't a good idea? I think so. I think that we're going to say that. So anyway, I really would like to make this channel something that delivers the news to you, the healthcare news, nursing news, that sort of thing. Also, the literature. Literature is something that is just completely forgotten by most nurses when they graduate. When they're in school, yes, you have to do papers, you have to get into the databases, and you have to do a lot of reading. And then when you graduate, you're just very busy with life and with working, and you're just not consulting the literature like you did as a student. I would like to bring some of that to you, and I think maybe that's one of the main focuses of this channel moving forward. So we'll see as it progresses, as I learn a little bit more about how this technology works and can make it a little bit more professional, so to speak, then I think we'll have a lot of fun. I know I'm having a lot of fun just learning. So thank you to the 5 or 10 people that occasionally watch this channel. I appreciate it. And I'll talk to you soon. Have a good night.